We're going to get started. Good morning. My name is Bruce Siegel, and welcome to the Senior Law Day Collaborative. I've worked with the Senior Law Day Collaborative since 2012, and I'm pleased to have you join us today so that you can learn about Medicare Open Enrollment Planfinder 2020. First, let me tell you a little bit about the collaborative and our programs that are available to you. We're composed of more than 150 professionals who are all eager to give you the latest information on legal, financial, and health issues related to aging for older adults. So I first wanted to just flag our website, seniorlawday.info. Here we are on seniorlawday.info, and you can see it's very conveniently organized, where you can register for our next webinar. On this tab, you can see our schedule of webinars. And then also, if you want to listen to a recording of our most recent webinar, you just click here, as well as all the prior webinars that we've been doing since the pandemic started. But I really wanted to point out something very special that we're doing tomorrow, which is free consultations. So you would get the opportunity, if after you listen to this webinar, you still have questions, or if you have other questions where you want to speak to an attorney or a financial planner, you can come back to this website at 3 p.m. this afternoon and sign up for a 15-minute Zoom slot tomorrow. So that's a great opportunity that I really encourage you all to take advantage of. A couple of other things on this website. Another resource is the Elder Law Q&A, a great resource book. And then if you have other questions that you just want to ask via the website, feel free to press the Ask Us button right here, and we'll get right back to you. But for now, I'm going to turn this over to our presenters this morning. We're excited to have Krishna Horrigan, who's the Outreach Services Programmer at the Westchester Library System. And he'll be assisted by Marianne Larkin, who's a program coordinator also with Westchester Libraries, to answer any questions together. They'll work on that. So with that, I'm delighted to turn this over to Krishna to begin the presentation.
Thanks, Bruce. I'm going to share my screen now and start my presentation. Okay, everything look good?
Looks good.
Great. So thanks for the introduction. Thanks for the background on Senior Law Day. And thank you to everyone who's participating today, attending this presentation on Medicare Open Enrollment, what you can change and how. So my name is Krishna Horrigan. I'm an Outreach Services Programmer at the Westchester Library System. I work in the Outreach Department there. And I'm joined today by Marianne Larkin, who's one of our program coordinators for our Westchester Seniors Out Speaking program. So what is Westchester Seniors Out Speaking, and why is someone from the library here talking to you about Medicare Open Enrollment? WSOS, as we call it, is a senior volunteer program that provides free, unbiased Medicare information through community presentations and one-on-one individual counseling. So we used to operate in libraries. We used to do one-on-one counseling at 10 different library sites around the county, and we used to do community presentations at senior centers around the county. But I think you are all well aware at this point that COVID threw a wrench in that and everything else. That's why we're presenting on Zoom today. And like everything else, like Senior Law Day, we moved online with our WSOS activities. So there's two things I want to highlight to you guys before I move on with the presentation. There's a lot of information that we're covering today, and it's only the tip of the iceberg in terms of Medicare. So there's going to be more questions from you guys. There's going to be more that you want to find out. One way that you can learn more is you can do the self-guided audio chapters of Demystifying Medicare, which was an in-person presentation that one of our volunteers would provide around the county. She graciously put that whole presentation online. She recorded the whole thing. We put it up there in chapters. You can find it on our wiki here. There's a link that you can click. We'll send the slides out about 2 days after this presentation. So Demystifying Medicare is one way to get a bit more of a deep dive into these Medicare topics. And then our Senior Benefits Individual Counseling Helpline. That's our one-on-one counseling. We're still active. We might not be in the libraries, but we are online. We're on the phones. You can reach us at either this email or this phone number, and you can find out more information at the Westchester Library's website right there. So today, we're going to be moving. We're going to follow this agenda. We're starting with a quick review of your Medicare coverage options. Then we're going to talk about Medicare Open Enrollment, which takes place from October 15th to December 7th. So, looking at the calendar, we're already in it. Medicare.gov Planfinder. So we're going to show you this tool and how you can use it. And then we're going to go over recent changes if we have time. So key takeaways. We're going to be covering a lot of information. I expect it's going to be a little bit hard to follow, but you'll always have the recording on seniorlawday.info to come back to, and you'll have the slides after the presentation. So my big takeaways that I want you to bring with you after the session is I want you to understand what the Medicare enrollment period is. I want you to know where you can find information about Medicare. And I want you to know where you can find help with Medicare information. So you don't need to know everything, and I don't think there is anyone who knows every single thing about Medicare, but it's all about knowing where you can find answers, where you can find those resources. Before I move on to the rest of the presentation, I also want to address questions. So if you have questions during the presentation, please submit them into the Q&A button. You should see that in your Zoom menu options down along the bottom of the screen if you're on a computer. And if you're on a phone, it should still be somewhere down there. It will look like this little stack of papers here. We will pause regularly throughout the presentation to address questions in that Q&A list. And if you have something that's really complex or personal or just a bit more involved than something that we could address here, then please feel free to reach out to the Civic Helpline, and one of our counselors will help you directly.
Krishna,
Yep.
I just wanted to just jump in and say that this as a Zoom event, we are being recorded. And as we mentioned, we will post this to the Senior Law Day website. But you are, however, as a participant, you're invisible and you're muted unless you choose to answer questions. So sorry for that.
No, thank you, Bruce. That's really important to mention. Your chat is not shared with the recording or anything like that. They only see me and the presentation. Okay. So we're going to start with a quick overview, a review of the Medicare choices available to you to set the stage for our discussion about open enrollment. Tip of the iceberg today. There's so much more information. We don't have the time to go in depth about enrollment, about all of the cost sharing, all of the premiums and late penalties and different things like that. If you're interested in learning more about that, especially if you're newer to Medicare, then I would suggest going to the seniorlawday.info webinars page and finding this recent webinar that the Medicare Rights Center conducted for us. And it's a webinar on Medicare basics. So it covers a lot of those basic informations in a lot more detail than I would be able to here today. So I encourage you to check out that presentation if you are curious and if you have the time. This is a flow chart that we often use in our individual counseling to show people what options are available to them. Some of you may be familiar with some of this terminology already, and you might know the words, but not necessarily have any kind of organization to them in your brain. So generally, there are two pathways that people want to choose when they're going with their Medicare coverage. There's Original Medicare, which we consider a kind of a la carte option where you pick parts and put them together to build up your full coverage. And then there's Medicare Advantage plan, where you basically are wrapping a lot of your coverage up into one overarching plan that has different cost sharing schemes. So Original Medicare is the billing is all managed by the government. And with Medicare Advantage plan, you're working through an insurance company like the ones that you're familiar with from your coverage while you were working. I would say that with Medicare Advantage plan, generally there will be a slightly lower upfront costs, like lower premiums, but there might be higher deductibles and there might be more cost sharing factored into all of the care that you're seeking. With Original Medicare, usually you're paying a bit more in way of premium for all these parts. And as a result, you're covered much more after the fact. And if you go for the maximum amount of coverage with original Medicare, some people like that because then you can just kind of go without really having to worry about or see a bill. Part A and Part B are part of the original Medicare and the Medicare Advantage plan. They're wrapped into the Medicare Advantage plan, as you can see here. Part A covers hospital insurance, Part B covers medical insurance, and then Part D is about prescription drug coverage. So that's really what we're focusing on today with open enrollment. And with original Medicare, there are little gaps in the cost sharing that you might want to cover. So that's where the Medicare supplement insurance or Medigaps come into play. So today we're going to focus primarily on Part D prescription drug coverage because that is the main thing that you can change during the open enrollment period every year. With original Medicare, you're signing up for a standalone Part D prescription drug plan. And with Medicare Advantage plan, that Part D drug coverage is folded into the plan, as is everything else. Before I move on from that, I just want to show you guys that there are many different places where you can find information about Medicare. That's not to say that it makes sense. A lot of this stuff is really confusing. It's arcane. So you can go to somewhere like Medicare.gov to get direct information. You can go to the Demystifying Medicare or Medicare Interactive websites to get a little bit more consumer-friendly information. And then Q1 Medicare goes a bit towards that complicated side, but it's really good details, very, very important details on there. So there are a lot of options to you. If you have the time, I encourage you to check out these sites to see if they have information about your Medicare questions. And there's always the Medicare and You handbook. So Medicare and You 2021 should have gone out through the mail. With everything going on with the mail these days, I'm not sure if everyone has a copy yet. So once you have these slides, this will be a clickable button that will bring you to a digital copy of Medicare and You. And this has all of the information that you need to know about Medicare, but it's not always easy to find within the booklet. And if you have the Medicare and You 2021 New York edition, which you should have received if you're living in Westchester County, then in the back of the book, it will actually have plan information about drug plans and Medicare Advantage plans. So if you don't have access to a computer, that is another option for you to be able to find information about plans during open enrollment. So I think I'll stop there because we've covered a bunch of stuff, and I'm just going to ask Marianne to see if we have any questions in the Q&A yet.
We don't have any questions on the Q&A, but there's a point I would like to add a little bit to what you said.
Absolutely.
That during this period, you're mainly changing your drug plan. Actually, you can change. It's focused on the drug plan, correct? But you can change from all your plans. You can change from the original Medicare to Medicare Advantage. You can change from Medicare Advantage back to original Medicare with a separate drug plan. So I just want to clarify that a little bit.
Thank you, Marianne. Okay, so on to the open enrollment. What can I do during the open enrollment period? Well, there are a few options here. You can join a new Advantage or Part D prescription drug plan. You can switch from an Advantage plan to an original Medicare plan, or you can switch from original Medicare to an Advantage plan. You can switch your plans, and we encourage you to switch your plans by calling the 1-800-MEDICARE hotline. And you can change your plans as many times as you want during open enrollment. So if you really want to go for it, you could change it 100 times. But the most important change is the last change that you make, which will take effect January 1st, 2021. So that's the last change you make before open enrollment ends on December 7th. Why would you change your coverage? I use the word change a lot in this slide, but things change. Things change from year to year. The extent of your coverage might change. So drug formularies, the drugs that are covered by your Medicare coverage, might change. Your healthcare needs might change. You might have new prescription drugs or new procedures coming up, things on the horizon, new care that you're seeking. You might be seeking care more frequently. Your plan should have sent you an annual notice of change in September, and on there, if there were changes that you didn't like to your coverage, then you might want to change your coverage. The cost of coverage can change, so premiums and deductibles are always changing. Drug prices change, especially as the formularies move around and drugs move from different pricing tiers. And participating doctors may change. So that's primarily with Advantage plans, but your doctor may, or your hospital group may actually move away from working with a specific Advantage plan, which, you know, if you like working with that doctor or that hospital group, that can be a problem if they don't accept your Medicare Advantage plan. You might just be unsatisfied with your coverage overall. And so this kind of ties into the other two, but it might just be not what you expected. Maybe you started with Medicare, with original Medicare, and you want to try out Medicare Advantage, or maybe you're on Medicare Advantage and you don't really like what you're getting. So you can switch back and forth. And sometimes another plan, you know, the pricing is quite similar, but maybe another plan offers similar coverage, maybe some extra little benefits here and there, or just a little bit cheaper that makes it worth switching. Okay, anything else in the Q&A, Marianne?
This has to do with a Medigap. You want to wait?
No, I mean, we can address that. I think I see it here. It's my understanding that you can change your Medigap insurer anytime during the year. Is that right? So you can change your Medigaps once a month in New York State. Is that correct, Marianne?
Yes, you can change that anytime in New York State.
Yep. And it'll take effect the first of the next month. That changes depending on which state you're in. So that's something to consider if you're sharing any of this information with your friends, or if anyone's watching this from outside of New York State. Just keep in mind, some of these specifics change. Okay, so let's talk about the Medicare.gov Planfinder tool. First of all, what is it? Important note. It's the official Medicare tool to search and compare drug coverage with pricing information included. So it's an official tool that Medicare.gov, the Center for Medicare and Medicaid Services, publishes. They updated it last year, and so there's a new system there. But they've always had this available on their website, and hopefully they'll continue to have it available. It's available year-round, but it's obviously most valuable during open enrollment period when most people can be changing their coverage. Some people might want to check in on it at different points in the year if they're first enrolling in Medicare, or if they have some sort of special enrollment period that allows them to switch their drug coverage. That's where the Planfinder becomes valuable outside of this open enrollment period. It's the official tool, but that doesn't mean it's infallible. It's had errors before. It was a little bit more sketchy last year as they were rolling it out. This year, it's had a little bit of a pricing conundrum at the very beginning, but it seems that most of those issues have been ironed out, but you never know if everything has been solved. So it's really important that no matter what you find on the Planfinder tool, you always confirm those plan details with the insurance company that you're looking at. You call them up, you ask them about the plan, you give them the plan number, and you go through all the prices and the costs and things just to make sure that all the information is correct. So the first step is to visit Medicare.gov. If you haven't been here before, there's a lot of really good information up here, but once again, it can be pretty dense, especially if you're new to Medicare. So check it out, but don't feel bad if you're having trouble understanding all the ins and outs of Medicare. If you need help, there are counseling groups that can help you, and other sites that provide more in-depth information. So the most important thing on this page for us to get to the Planfinder is this button right here, Find 2021 Health and Drug Plans. That's where we want to go if we want to access the Planfinder tool. There are a few other buttons down here to find more information, find providers and facilities and things like that. And there's actually a button here to look at 2020 health and drug plans in case you ever needed to look back at your current coverage or something like that. So once we've clicked on that button to access the Planfinder, we're greeted with another page here that asks us if we want to continue with by logging into our Medicare.gov account, or if we want to continue anonymously. So when we're counseling people, we always use the anonymous continue without logging in option, just because that way it's not saving any information. I would encourage you, if you're using a public computer, not so common these days, but if you're in the library using a public computer and you're going to use the Planfinder, continue without logging in. That way it's an extra layer of security to make sure that it's not saving your information, that somebody can't come to the computer and pull up Medicare.gov and see your drug list or anything like that. But of course, if you're very tech savvy, if you're interested in having a Medicare.gov account, then you can log in or create your account here. And that will give you just another portal to be able to look at your drug lists, your expenses, your current coverage, things like that. Okay, so once we've continued without logging in or with logging in, then it's going to ask us for a bunch of search details. So this helps the tool narrow down exactly what we're looking for. First, it's going to ask you what type of coverage you're looking for. So primarily when we're using this tool, we're looking at Part D coverage, or we're looking at a Medicare Advantage plan. But it also offers a few other options, and we'll see that later when I do the live website demonstration. It lets you look at Medigaps as well. It will ask you what your prescription drugs are. It will ask you for a drug list, and the reason it's asking you that is so that it can show you pricing for these different plans. If you continue without adding any prescription drugs, then it won't really give you very valuable information. It'll tell you the premiums and some of the plan details, but it won't tell you exactly how much you're supposed to be spending for the year of 2021. And then last, it will ask you which pharmacies you generally use. And mail order pharmacies are also an option there. And the reason that it's asking that is because with every prescription drug plan, they have different pharmacies that they prefer. Some of them are in network, some of them are out of network, some of them are preferred. So the pricing can once again vary depending on which pharmacies you're using. Okay, so once you've entered all of that information, then you'll be brought to a page with results. It will list a bunch of drug plans that are available or Medicare Advantage plans if that's what you're searching for. And there are a few things that show up at the top of that results page that I want to show you before moving on to the actual plan information. Up here in the top right, you'll see that there's a button that will let you switch seamlessly over to Medicare Advantage plans. So that's a good way for you to switch. If you've entered all your drugs in your pharmacies, you don't want to enter them again another time to go look at Medicare Advantage plans. So that's a way that you can quickly switch over and keep all of your other information in here to see pricing and coverage. There's also a green button here on the right side, filter plans. And this will let you filter the plans by a few different criteria, one of which is the insulin savings option. And this is also, I think, the senior savings program is what it's referred to as. And this is a program to standardize and lower the cost of insulin on your drug coverage. So you can actually filter to only show plans that are part of that insulin savings, senior savings programs. Also important is that you can sort plans by different criteria. And by default, the Planfinder tool will search by lowest drug and premium cost. So it's combining the cost of your drugs and it's combining the cost of your premiums for the year. It's piling those together and then looking for the plans that have the cheapest total of what you're expected to pay in 2021. So that's the default search. And I think it's good to keep it at that. You can always play with it, but keeping it as lowest drug and premium will generally get you the cheapest coverage. Also important up here on the top left side, you've got the option to change your location and also to edit your drugs and pharmacies if you have a reason to do that. Okay, so once you're on that results page, you can scroll down and you'll see actual plans listed out. And when you're looking at those plans in a list, it shows you first a couple of summary details for each. So this is one plan that showed up when I did a search, Express Scripts Medicare Saver PDP, Part D prescription drug plan. It'll show you the monthly premium. And note, since I'm looking at Part D coverage right now, for a standalone prescription drug plan, it says only drug coverage. If you were looking at Medicare Advantage, it would also say health premium as well. And then it'll show you your yearly drug and premium cost at the cheapest retail pharmacy that you entered. And then also, if you chose to include mail order pharmacy, it'll show you the expected prices there. It'll show you your deductible, and it will show if your pharmacies are in network over here. So there's an enroll button down here. I don't know if anyone's been looking at that yet while I'm speaking, but I want to remind you, it's best to enroll at 1-800-Medicare. If you enroll through the particular plan, then there's paperwork going on between your plan and your new coverage and your previous coverage, and there's chances for things to get lost. There's more hands, there's more cooks in the kitchen. If you call 1-800-Medicare, the government's Medicare helpline, then you can make changes to your coverage directly. They will change your coverage. It's the quickest, most sure way to make sure that you've actually changed your coverage and to make sure that you won't have a nasty surprise on January 1st next year. Next up is that plan details button. Really important if you want to drill down into this plan and look at all of the breakdown of costs and things like that. And then the last thing that I want to point out is this add to compare option. You can see it's a checkbox, and that's because you can check off multiple plans, I think up to 4 or maybe up to 3, and you can compare the plans side by side. And so that's a quick way to be able to just quickly look at the premiums, the drug costs, and kind of decide between 3 options. So first, we're going to look a little bit more at plan details. When you click that plan details button, it brings you into a much more detailed page where you can find the actual breakdown of your drug costs for each pharmacy. So at that plan that I was looking at on the previous slide, I clicked into the plan details. I scrolled down to the CVS pharmacy drug costs. And this is just one example here where it shows the drugs that I had entered. It shows their retail cost before you've met your deductible, the cost of the drugs after you've met your deductible, and then the cost while you're in the coverage gap or after the coverage gap. Yeah, Bruce?
Yeah, I just wanted to take a moment. We do have 2 questions in the Q&A. And then also, there was really interesting, if you go to the chat, there was an interesting question that one of the attendees answered that Marianne answered privately. And I think that's worth I would not have guessed the answer to that question. It almost surprised me a little bit. So I think it's a moment. Let's just take a couple of minutes to just sort of catch up on some of these things.
Okay, so I'm looking at the Q&A. I see someone saying, but calling 1-800-Medicare with their limited staff means being on hold for 1 hour or more. That's true. It is a bit of a slog. Little secret tip that I've heard from one of our volunteers: if you call and ask for someone in Spanish, you can usually get a quicker response. But of course, that requires you to be fluent in Spanish. So yeah, leave some time if you're going to call 1-800-Medicare. It takes a bit more time to get in touch with them, but the results are valuable.
Krishna?
Yeah.
This is Marianne. On that, Medicare is available 24/7. So you can call 2 o'clock in the morning.
That's another way. I think we have a few volunteers who take advantage of that as well. But then again, that depends on your sleep health, right? Okay, someone says, why is the premium cost for the year so low? Isn't it $23.60 times 12? So yes, let me go back to that page here. It's showing you right here the monthly premium by month, but when it factors in the premium cost down here, it is factoring in the 12 months of premium. So up here, it just shows you what you're paying per month. Down here, it's your drug costs plus your premium. Okay.
There was also a good question in the chat. Can you change your Part D coverage anytime during the year? I don't know if Marianne, if you want to jump in on that, or Krishna, either one of you want to take.
Yeah, I can start us off, and then Marianne, let me know if I miss anything. But you can't change your Part D coverage anytime during the year. Open enrollment is really your best bet to change it if you are currently on Medicare. Obviously, if you're new to Medicare, if you're enrolling, then you have a chance any time of the year to sign up for a drug plan. And there are a few other really specific special enrollment periods that I wouldn't say you can rely on, but there are chances for you to change your drug coverage outside of the open enrollment in extenuating circumstances. Marianne.
Yes, there are special enrollments when you are allowed to change your drug plan. Also, in New York State, we have that drug assistance program, I call it the EPIC, which if you are eligible and you are a member, you are allowed to change your drug plan one more time during the year outside the open enrollment period.
When you sign up for it?
Yes, when you become a member, if you're eligible to become a member of EPIC. And I don't know whether you plan to talk about that later or not, or do you want to?
I'm not going to cover EPIC in detail,
Okay.
but it's mentioned at the end, and if we have time, we can cover that as well. We can go over EPIC a little bit more.
Right.
But it's something to be aware of as an additional cost-saving program for your pharmaceuticals and as an option to open up another special enrollment period. Thank you, guys. Okay. Did I finish this page or did I only start it? So we've got our price breakdown here. You can see this $35 expense for the Lantus, which is insulin, is part of that senior savings program, the insulin savings program. At the bottom, it shows you your monthly totals and an estimated total drug and premium cost once again. And it will tell you some other important details like when you'll meet your 22, this little slide thing is coming up in the bottom. It'll show you when you meet your $285 deductible for this plan, which would be in January, and then when you enter and exit the donut hole or the coverage gap. So on that plan details page, right below this information, if you scroll down just a little bit more, you'll actually see a monthly breakdown of your estimated drug costs. So this breakdown doesn't include your premium. It's showing you just exactly what you'll pay, what you're supposed to pay for your drugs by month. So you'll see January is a little bit more expensive, and then we hit our deductible. February through April is cheaper, and then we start to enter the donut hole there. And then at the very bottom of that plan details page, that's where we encounter contact information for the plan. So where does that come into play? Of course, it's important when we want to confirm our coverage. When we want to confirm those drug prices, we want to confirm deductibles and coverage with the plan. Planfinder may have errors. Once again, call 1-800-MEDICARE to enroll. That's our preferred method. And then if you have Medicare Advantage plan, or if you're looking at Medicare Advantage plans, on top of calling the plan itself, you really want to call your doctors or your hospital groups, wherever you're seeking healthcare, to see if they accept the plans that you're looking at. Okay, oops. So back, aside from the plan details, back on the front page, I showed that there was a comparison option. And this option lets you check off up to 3 plans and then compare them to look at them side by side. So you can see here, I think for this, I picked the top 3 plans, and you can see how the premiums differ and the deductibles differ. And then on this comparison page, you can continue to scroll down as well and see other things like whether all of your drugs are covered by each plan. And then actually you can see a summary of all of the pharmacy, the different pharmacy costs for each of the plans. So, looking vertically, this first plan, it looks like the cheapest option is Sam's Pharmacy. The next cheapest option would be mail order. By contrast, this second plan that we're looking at here, the cheapest option by far is the mail order, followed by CVS. And then this third option, the cheapest plan is mail order, followed by this Village Pharmacy that I picked, Marinelli's. So things can change by plan. That's the value of looking at the comparison tool, because if you're really, for some reason, you don't want to go with mail order, some people just prefer to go into a pharmacy or get their drugs from a familiar pharmacy, then it's worth looking at these plan details, because one plan might show you that it's the cheapest plan, and then you find out that it's actually just the mail order option that's the cheapest. Okay, so I'm going to stop again and see if we have any questions. I see something in the Q&A here. What does the cost in coverage gap and cost after the coverage gap mean? So that is, you might have heard of it referred to as the donut hole, and I'm going to let Mary Ann take that one.
Well, I think it might be good. Can you pull up that screen that shows that donut hole?
Yes, let me go back to that. There we go.
Yes, the amount for 2020, I believe, is $4,130 to get into the donut hole. And once you reach that amount, then you have to pay more for your drug. And for the brand name drug, it's 25%. So you are in the donut hole. And once you reach the amount of 6,000, I don't have the exact figure, but it's 6,100 some dollars, then you're out of the donut hole and you are in the coverage after the coverage gap.
So Mary Ann, those numbers are much higher than what I'm seeing on this page.
What number are you talking about?
The 4,000 and the 6,000?
Well,
They seem much higher than what I'm paying, right?
Well, that's when your total drug, all your drug costs for that period reaches 4,100 some dollars. You're in the donut hole.
And what the plan is paying as well, right? So it's
right,
what you pay plus what the plan is paying.
Yeah, it's what you pay out of pocket, excluding the premium, and what the plan pays. That total comes to 4,100 some dollars. And then while you're in the donut hole, you pay 20% for brand name drug. And probably a little less for the generic drugs until you reach a total of 6,000 some dollars. And then you're out of the donut hole, let's call it, and you're in the catastrophic where you pay about 5% of the cost.
So this is what I meant when I was saying that this stuff is so confusing. And even if you spend all your time trying to understand it, you're going to need help at some point.
That's a very basic explanation for being in the coverage gap and outside the coverage gap. It has to do with the amount you spend and where you land. Let's put it that way.
So it's reflected here in the cost overview, and then it's reflected somewhat down here in the monthly breakdown if you see the prices changing. Okay, right. So I think that brings us to the live website demo. We're going to take a look at this thing live. So you guys can all still see my web browser, right? This is the Medicare.gov website that I was talking about. You'll recognize it from all the screenshots in the presentation. Right here, we've got our Find 2021 Health and Drug Plans. Let's click on that. And here's our splash page of the Medicare 2021 Medicare Planfinder. Up here, there's the option to log into your MyMedicare.gov account and then continue without logging in. I don't have a MyMedicare.gov account yet, but I'm going to continue without logging in here. If you're curious, there's also an option to learn a little bit more about Medicare down here. And then if you, for some reason, have a special enrollment period or you need to look at 2020 coverage, this is how you can look at 2020 coverage down here. So let's just continue. We want 2021. We're looking forward to the next year. Let's continue there. So this is where it's asking me a few quick questions to narrow down my search. First, what type of coverage do we want? So you can see there's Medicare Advantage plans. There's Part D and Medigap, Medigap alone.
Excuse me, Krishna, may I point something out? You Definitely. Want to see the 2021 plans up top.
Yes, up here, you're right. This is something that I think someone mentioned in the chat as well. Up at the top, it'll show you which plan that you're viewing, which set of plans you're viewing. So we want to be viewing 2021. If we instead decide we want to look at 2020, there's a button here But for the purpose of this presentation, for your purposes, you'll generally want to be looking at 2021 plans. So from these options, I'm just going to pick the Part D plan. And then I'm going to enter my zip code. That's Elmsford. It'll tell you what county you're in, so that's always good to just confirm that you've entered the zip code correctly. And then it'll ask if you get help with your costs from one of these programs. Notice you won't see Epic on here because that is a New York State specific program, and this is a countrywide tool. So for today, I'm just going to pick the option that says I don't get help from any of these programs to keep it a little bit simple. Next, it's going to ask us if we want to see our drug costs, and I always chuckle at this question because you know, that's most of the reason that we're here today. So yes, absolutely want to see drug costs. Let's do retail pharmacy and mail order pharmacy. And then I'm going to hit next to continue on. Okay, so this is where we can add our drugs. We can type them directly here, the name. If we're having trouble finding it or spelling it, then you can actually browse for your drugs A through Z. This is a quick way to find a drug if you're not exactly sure how to spell it, or if you can't remember the exact name. But I encourage you to have the drugs there in front of you while you're filling this out so you can have all of the dosage information on hand. So let's start typing in some drugs here. So you can see that when I'm filling out a drug, it's going to start trying to guess what I'm going for. I'm trying to fill in atorvastatin, and I see it right there, so I can actually click that and add a drug. So after that, you will select the dosage. You'll select the frequency with which you get refills. So let's say I refill this every month and I take it once a day, then I'm just going to say I get 30 every month. If I'm taking two a day, then 60. If I take one every other day, 15. So you got to do a little bit of math there, but you should know generally what frequency you're refilling at. So you just fill this in however you need to, and I'll add it to my drug list. And I don't want to just have one. I want to show you guys a couple of different prices. So I'm going to keep adding drugs. Let's do Eliquis. I'll add that. Let's keep adding drugs. I'm going to hit this find and add drug button, and I'm going to add Lantus. That's our insulin again. And we'll add one more here. Let's add metformin. Ooh. Let's just say 30 a month. Okay, once we're done adding all of our drugs, we're going to scroll down to the bottom. You know, depending on your prescriptions, you might have more here. It might take longer. And so once again, if you're going through a loan, the benefit of signing in with a Medicare.gov account is that you can save it. It should save your drug plan, your prescription drug list between visits. It's always good to double check though, because sometimes it might throw something on there like a shingles vaccine or some one-time thing that you got, and you don't want that to be in your plan pricing prediction for next year. So we've got our drugs here. Let's scroll down. Let's hit done adding drugs. And then we can choose up to 5 pharmacies. So this is a little bit like a search for restaurants or something. We've got a filter by distance. You can put in a zip code or a direct address if you want something more accurate. And you can also search by a name of a pharmacy. That's really valuable if you know some local pharmacy that you use and you're having trouble finding it. But by default, it's just going to show me the 10 closest pharmacies from the zip code, the center of the zip code that I put in. So mail order is already on there. Let's just throw in CVS. Let's throw in Marinelli's and Sam's. And actually for this one, for the live demo, I'm going to switch to Walgreens. Now, if you don't see the pharmacy that you're looking for on this first 10, but you know it's still close by, you can go to the next page of the results. And you'll see it starts at number 11, it'll go up to 20, and you can see further out pharmacies and pick from those. But I'm happy with the 3 that I selected, and we're keeping mail order pharmacy in there, so I'm going to select done. Now we're seeing our 28 prescription drug plans available. Up here in the top right, we see that we have the option to switch to Medicare Advantage plans if that's what we want to look at. Once again, up here in the top left, we are looking at 2021 plans. There's an option to look at 2020. If you need to change anything down here, the location or your drugs and pharmacies, this is where you'll do it. And on the right side now, let's look at those filters. So I only showed you the button before, but now we get to look at the actual filters. So there's an option for drug coverage that's accepted across the US. Important if you're traveling or if you're a snowbird. Star ratings, if you care about that. I don't know how accurate or important these are for searching on the Planfinder. You can search by a specific insurance carrier. Just know that if you pick a specific insurance carrier, then you're not necessarily going to get the cheapest coverage. But if you're fixed to that group for whatever reason, then you'll find the cheapest coverage amongst their plans. And up here, we have our insulin savings toggle. And there's even a little button that describes what that toggle does in case you forget. So let's toggle that on. Okay, we've got our filters. Let's apply our filters there. And right below where we had filters, you've got sort plans. Remember, it starts by default on lowest drug and premium cost. Some of the other options are lowest yearly drug deductible and lowest monthly premium. So if you sort by only lowest monthly premium, you might find the lowest premium, but then your drug prices might be higher than some other plans. So it's going for this combined cost is usually the quickest way to find the cheapest coverage. Okay, so we've got Cigna Secure Extra RX PDP here. These are the buttons that you saw in the slides. You've got your enroll button here, plan details, and then add to compare. So before I go to compare, I'm just going to go into plan details once again to show you what that page looks like. Now we can scroll down through the page to see all the details, or we can skip directly to a place by using this sidebar. So maybe if I want to go straight down to drug costs, I can click down here, but I'm going to scroll down to give you guys a look at what we can see here. So we've got our premium, deductible, tiered drug costs, and then our pharmacies. This shows us that they're in-network. CVS and Marinelli's, standard in-network pharmacies, and then Walgreens is a preferred in-network pharmacy, which usually means that the drug prices there will be cheaper, but that's not always true. And let's scroll down. So now it's going to take me through the pharmacies that I entered, and it's going to show me that cost breakdown. So here we have CVS. It's showing us the cost breakdown once again, showing us total of what we'll pay per year. And then we've got our monthly drug cost breakdown. Scrolling down a bit, we have our Marinelli's Village Pharmacy. It's going to show us the same exact information. The prices might be a little bit different, but the layout is the same. And it'll show us our monthly coverage, our monthly prices. And then we've got Walgreens, and Walgreens will show us their prices, $3,358 per year. You won't meet your deductible? That seems odd. We're paying more than $100, so this could be actually a bug in Planfinder, and that's something that I'll report. Oh my gosh. Okay. Scrolling down, we've got our estimated monthly drug costs, and then once again, mail order comes at the end to show us their prices. And I'm just going to keep scrolling down. It shows you what tier these drugs are, which correlates usually with pricing. And then it shows you, once again, your selected drugs. There's an option here to change things too. So if I decide that maybe there's a generic I want to go for with one of my drugs, then I can change it to the generic there. A little information about Part B drugs that we're not going to cover, but generally that's things that are administered by a doctor, not prescription drugs that you're picking up at your pharmacy. And those are covered by Part B. And then down at the bottom here, that's the contact information where you can find the plan's website. You can find their mailing address, And you could find a phone number for people who are already on that plan or people who are interested in signing up for the plan. So this is the number that you're usually going to use if you're calling to confirm details. So let me take this shortcut to go all the way back up to the top so I don't make everyone dizzy with scrolling. Another key part of information that I want to share with you guys before I move out of this plan details page is the plan ID. So when you're calling Cigna to confirm details about the plan, this plan ID is going to help you identify the plan to them much faster than sharing this name. Keeping the plan ID is generally a good step. So let's go back to the search results. I'm going to show you guys the comparison tool now. And I'm going to try to move quickly because we're running out of time here. So I'm going to add the first 3 plans, which are supposed to be the cheapest plans to compare. And then I'm going to click compare down here in the bottom right. And now you'll see, once again, they're side by side. You've got the premiums, the deductible, and then scrolling down, you'll see that, oh, this middle plan, Walgreens is actually out of network. For these other plans, Walgreens is preferred in network. For some reason, this middle plan, they don't have a deal with Walgreens, completely out of network there. And you can see the pricing is correspondingly huge. Down below, you have a quick buttons to get to the plan details for each of those plans that you were looking at. So the comparison is helpful if you're just trying to get a quick overview, but the plan details is really where you're going to find most of the granular information that you're going to want to confirm later with the plans. Okay. One more thing to cover. If you are calling the plan to confirm details, write down all of the information about that call. Write down the name or the employee ID of the person that you're working with, the service representative that you're working with, so that if they have a ticket number, write that down. You want to just keep a paper trail of these interactions so that if you opt for a certain type of coverage and then you realize later on you were misled or something was misrepresented, then that's grounds for you to be able to challenge your coverage and maybe get a special enrollment period. So just always keep details on these interactions. And I think before I move on, I'll just show you what happens if we click this View 42 Available Medicare Advantage Plans. It brings you to very much the same layout with Medicare Advantage plans. There are a few other options to filter because Medicare Advantage plans have slight differences. And then once again, you've got your plan details and your ability to compare. So I think I see nothing in the Q&A. I'm going to jump back into the presentation and take a little breath here just to say that nobody's expected to be an expert after this. We've covered so much information. There's so much more to learn and to see. So I want to share with you guys counseling resources. Oh, Bruce?
Yeah, I was just going to take a minute while people catch their breath and think about whether they want to enter any questions into the Q&A. I just wanted to just take a moment to thank our sponsors for the Senior Law Day programs. People, can you see that slide? Can you see the slide?
Yes.
Okay, so this has been really great. Even though it's been a tough year, our sponsors have come through and enabled us to move to virtual programmings and continue the programs that we've been offering live, but more on a virtual program. So I just wanted to thank all of our sponsors. Okay, back to you.
Yeah, and that's not to say, I mean, there's also, we got to give a hand to everybody who's involved in the Senior Law Day Collaborative.
Yeah, that's right.
In the presentations, in the counseling sessions that they've been putting together, like the 15-minute consults. It's a lot to put together, but you guys are doing a great job. Okay, so counseling resources. Oh, I think we have something in the Q&A. We got a thank you in the Q&A. Thank you. Counseling resources. So we didn't cover a lot of stuff today. We didn't cover anything about Medigaps, except that you can sign up anytime in the year, or switch anytime in the year. We didn't really go over the specific cost sharing breakdowns between Original or Advantage. We didn't talk much about Epic beyond a brief introduction to the pharmaceutical assistance program. And there's just so much more that we didn't cover. So one place where you can find information and answers, the library system's civic helpline, the one that I mentioned at the beginning of the presentation, email, phone number, and there's also information on westchesterlibraries.org/civic. Medicare Rights Center has a helpline as well, a national helpline. There's some information on this slide. You can take a look at the video recording or the slides after this if you want to read that paragraph there, but it's just another helpline where you can find answers. And Medicare.gov, their 1-800-Medicare line. I brought it up a ton of times. I got to bring it up again. It's there if you have questions about specific billing, questions about claims, medical records, expenses, a lot of the more logistical side of Medicare. And you can also log into your MyMedicare.gov account to find information about that stuff too. And I got to point out the Westchester Department of Senior Programs and Services. So this DSPS, as we call them, has a number of helpline services there. They've got really good information on their website. Great place to call if you have questions about any type of senior benefit, if you need help with rent, transportation, a wide range of stuff, heating, SNAP, food stamps, they've got your back. And just a quick review, some bonus library resources for you. I had to do it. I'm coming to you from the library system. I have to talk about some of our stuff. I have to brag. We have a few research tools that are available for you guys. You can find them on westchesterlibraries.org/research tools under the health section. I bring up the health just because it's a Medicare presentation. Explain, which is a plain language medical information database. So you can go in there and search up information about body parts, about disorders, diseases, anything, and it'll try to explain it to you in plain language. Consumer Lab, so this is available for free to you as well, and it's information on supplements. So you can find out safety information, you can find out information about contents, warnings, things like that. And then unrelated to health, the New York State Talking Book and Braille Library has a program where anyone with a visual or motor impairment, no age restriction or anything like that, that would make, anyone with an impairment that would make reading a book difficult can get a talking book player and audiobooks delivered for free to their home. It's a free library service, all done through the mail. Or if you're tech savvy, you can actually download the audiobooks directly onto a tablet, your computer, a smartphone, things like that. Here's their website, here's their phone number, and an email address for them. Okay, and don't forget to check your own library's website. There's also a compiled list of virtual programs that are happening around the county. Check it out. I think that's it for my presentation, and I don't see anything else in the questions or the chat. Thank you so much, everyone, for helping out, or for attending today. Thank you, Marianne, for helping out, and I'm going to pass it over to you, Bruce.
Yes, thank you, Krishna and Marianne. That was terrific. Thank you for your time, and let everyone move on and have a great day. Take care. Bye-bye.